Hello everyone, welcome to our course Introduction to Basics in Veterinary Diagnostic Imaging. I am Dr. Dayamundi Matthew, Assistant Professor, Department of Veterinary Surgery and Radiology, Faculty of Veterinary and Animal Sciences, Institute of Agricultural Sciences, Banaras Hindu University. In this section, we will be learning about production of quality diagnostic radiograph, which will include the X-ray image formation and the processing of films. Introduction. The objective of radiographic imaging is to procure an image that is most accurate to the structure being radiographed. The sharpness, size, and shape of the image of the object contributes to the accuracy. Image magnification. There are three geometric factors that affect the radiographic quality. They are the image magnification, image unsharpness, and image distortion. Image magnification. The principles of ordinary shadow or a photographic and radiographic image are similar. If an object is placed in the path of a source of light, a shadow is formed. As the object is brought nearer to the source of light, the shadow enlarges, and vice versa. So this is very important when we talk about when we talk with respect to radiology. Image magnification shall be kept as minimum as possible. Magnification of some degree is usually present in every clinical radiograph because the image formed is a two-dimensional representation of a three-dimensional structure, which means that inside the abdominal cavity, if we have to take a radiograph of the abdominal cavity has got different organs which has got a 3D structure, which has got a thickness, and we are going to get a radiograph which is a flattened image which is in the form of a 2D structure, 2D representation of a 3D structure. So when we make one such thing, there can be some degree of magnification in almost all the clinical radiographs. But the principle that says is that we have to keep the magnification as low as possible so that we will not misdiagnose with the image that we are going to see there. To achieve this, the part to be examined should be kept as close as to the film as possible, and this is called as a part film distance, and a part film distance should be effectively, it should be 0, but which may not be sufficient, which may not be correct in all the situations, but make sure that the patient is in contact with the cassette. Just like I said before, if we have to take a radiograph of the abdominal cavity, especially for the stomach, we cannot have the stomach that directly placed over the cassette. The PFD will never be 0, but we can place the patient over the cassette without any space in between, making the patient and making the distance between the patient and the cassette and the film 0 centimeters. The distance between the focal spot of the tube and the film also influences the magnification of the image. This distance is called as the film focal distance. At a higher film focal distance, only parallel rays around the central ray from the image as the divergent or the peripheral rays are cut out by the cone or diaphragm, thereby reducing the magnification effect. If you can see over here, there we are having two different focus from where the radiations are coming out. Let us name it like A. Let us name this like B. if we talk about, if we are going to have a film focal distance, and let us keep it like film AF and BF. When we talk about AF, the film focal distance is less. When film focal distance is less, if you can see, this is the portion where the patient or the part is kept. The X-ray photons that are going to pass are going to pass in this direction, and we are going to get an image on the film, something like this, which is enlarged. While when we make this distance greater, a B, if you see the second picture, the angulation has reduced, and see the size of the image that has formed. It is much lesser than this one, picture A. The image that has formed in the picture B is much lesser, and this is all because of the reason that more of the parallel rays are coming out through this part, through when we increase the film focal distance. And for this reason, the magnification is also going to get reduced. When the film focal distance is going to get reduced, the magnification is going to increase. When the film focal distance is going to get increased, the magnification is going to get reduced. Usually, the FFD that we the film focal distance that we keep in veterinary radiology is somewhere around 90 centimeters, which can provide us good quality radiograph with very less magnification. The next one is the image sharpness. This includes penumbra or the edge gradient effect. Second one is the motion unsharpness. The third one is the absorption unsharpness, and the fourth one is the screen unsharpness. What do you mean by this penumbra? This refers to the region of the partial illumination that surrounds the complete umbra that causes undesirable blurred region on the radiograph. Umbra is nothing but the true shadow. So there is a true shadow around. Beside to that, we are going to get some other portion of partial illumination. So that's called as a penumbra. This is also called as an edge gradient or the geometric unsharpness. The maximum unsharpness of image is achieved by placing the object of great interest towards the anode side of the X-ray tube. If we can see over here, the photograph over here, the picture, the anode, it is rectangular in size and it is having a tapering on the edges. So we are going to have two different deflections from these anode portion. When it is going to hit on the nearer area, we are going to get an image here, and a second image will be formed on this side. This is called as the penumbra. When there is a deflection of the X-rays from the anode after hitting it, we are going to get some information on this area as well, and that is called as the penumbra. This penumbra will be less towards the anode side. It will be less towards the anode side, while it will be more towards the cathode side. The factors that affect the formation of penumbra on a radiograph are the large effective focal spot size, the short focus film distance, and a long object film distance. To minimize penumbra, place the object as near as possible to the film. If we place the object as close as possible, we can reduce this effect of penumbra or the edge gradient. The next one is the motion unsharpness. In motion unsharpness is nothing but the loss of radiographic quality due to the movement of either the patient or the X-ray tube or the film during radiographic exposure. And it may be reduced by using shortest possible exposure time and appropriate restraining measures. When there is going to have a motion unsharpness, I am going to get a radiograph with very less detail. The sharpness is going to reduce a lot. I'm going to get a blurred image on my radiograph, and this can be due to the movement of the patient, movement of the tube, or the film, the movement of the film during the radiographic exposure. And for this reason, we can do a chemical restraining of the animal. We can also have exposure time reduced as minimum as possible, so that the blurring, the motion unsharpness can be reduced. The third one is the absorption unsharpness, and this is due to gradual change in X-ray absorption across the boundary or periphery or center of the object. And this forms the unsharp edges, and this is related to the shape of the object, so it can be seldom controlled. So which means that we are going to have a structure which is of different size at different locations. And if we are going to take a radiograph of one such structure, we are going to have the X-rays absorbed at each a difference in the absorbed X-rays at different locations as per the thickness or as per the shape of the object. And this is going to cause an unsharpness of the image, and that is called as the absorption unsharpness. The next one is the screen unsharpness, and screen unsharpness is due to light diffusion in screen phosphor layer, and it can be avoided by maintaining a good film screen contact and by using a fine grained screen. Use of intensifying screens with high intensification factor reduces exposure factors but causes image unsharpness. The third one, the geometrical factor, is the image distortion. It is a radiograph. A radiograph is not an exact picture of the structure being examined, and differences of varying degrees are present in the shape and size, and such misrepresentation of shape and size is called as image distortion. It can also be defined as unequal magnification of different portions of the same object. The distortion of the image, it can be due to the shape of the object and position of the object. The image is not distorted if the object is positioned parallel to the film, and if it is inclined, the image would be smaller than the object, and that is called as foreshortening of the image. So I would like to say, like, if you have to take a radiograph of any part, make sure that the part and the film are placed at 90-degree angle to the X-rays. It shall hit in a 90-degree angle, one thing, it shall hit in a straight line. It shall not hit in an inclined angle. When we are going to have an X-ray beam hit a structure in from an angle, I am going to get an image which is shortened, which will be smaller in size, and that's called as foreshortening of the image. Next is recording of the image. Radiographic image is the pattern of information that an X-ray beam acquires as it passes through different body tissues after interaction. The X-ray image, it is not visible until it is converted to a visible image by appropriate means. A photographic film is one of the most widely used materials to decode useful information from an X-ray image. And also, once it becomes an X-ray image, useful X-ray image, it is going to be a permanent record for information. So, the X-ray images are not cannot be viewed by our eyes. It has to be converted into an image which will be visible for our eyes, and it can be made only when it is converted into certain films. And what we use is a photographic film, usually for recording of the image. The composition of the X-ray film. X-ray film and the photographic film are similar with respect to its composition, and the size of an X-ray film is somewhere about 0.25 millimeters. And it has got 4 different portions. There is a base at the center, and on either side of it we get an adhesive portion, and across later the adhesive portion we have the emulsion portion, and then covering that we get a gelatin. Out of this, the most important thing for the image formation during a radiographic projection is the emulsion portion of the X-ray film. This emulsion portion of the X-ray film contains a mixture, a homogeneous mixture of gelatin and silver halide crystals. This gelatin, they keep these silver halide crystals well dispersed within it, and it prevent their clumping. The processing solutions, they can easily penetrate through this gelatin without affecting its strength or performance for converting the latent image into a radiographic image. Later to that, to the emulsion portion, we have a gelatin portion which is going to protect these emulsion portion of the X-ray film. Next is scatter radiation. These are radiation that deviates from the primary beam both in direction and wavelength after interacting with a medium or a patient being exposed to X-rays, which means that the X-rays are going to come out of the X-ray tubes. It is going to hit certain portion of the patient, and since it is not uniform, the surface of the patient is not uniform, it will hit and it may get deviated instead of going directly deep into the cassette, into the film. Those rays which gets deviated from the primary beam, they are called as the scatter radiation. When we talk about the scatter radiation, there are 2 types of scatter radiations. One is called as a backscatter, and the second one is called as a forward scatter. A backscatter is the one when the photons are getting deflected at an angle more than 90 degrees. That's called as a backscatter. While a forward scatter are those scatters which occurs when the deflection angle is lesser than 90 degrees. When we have the KVP setting low, the scatter that we are going to get is a backward scatter. While we increase the kilovolt setting in the machine, we are going to get a forward scatter. The relative intensity of the scatter radiation is directly proportional to the kilovolt, body part thickness, and the field size. The scatter radiation can be minimized by using collimators and grid. Also, certain filters are also helpful in reducing this scatter radiation. What is this collimation? Collimation is the regulation of X-ray beam by beam restricting devices to restrict it to the site of the part of the patient under examination. And this collimation is going to reduce the scatter radiation, and it is going to decrease the patient dose. The second technique by which we can reduce the scatter radiation is by using the grids. The grids are flat plate containing series of alternating strips of radiodense. Usually it is made up of lead, these radiodense strips, and alternating with a radiolucent material encased in the protective covering of aluminum. And this is usually placed between the part to be examined and cassette so as to absorb scatter radiation falling on them, on the film. And grid is used when the thickness of the part to be radiographed measures more than 10 centimeters. So, these are alternating strips, and the strips of radiodense and radiolucent material, and the radiodense material is made up of lead, and this would be something like this. When the X-rays are going to pass from above, the patient is placed over here, or the part is placed over this. When the X-rays are going to pass, the X-rays will only allow those, the grid will only allow the entry of those radiations which are passing in a straight line, while certain radiations would, X-ray photons would be there, which would be coming in different directions, or which may be scattered. These radiations will get absorbed by these grids, the radio dense strips, and it will just allow the information that will be carried by those photons that are passing directly through the part to be radiographed onto the cassette, by which the film will not have any unusual or any information that would be leading to a wrong diagnosis. Next is we have got the latent image placed on the film, and we have got that image on the X-ray film at this moment. But this image again is not visible to our eyes. So the image that has been formed on the film, it shall be converted into an image for us to see what is happening inside the patient. And that processing of the film is called as the processing of the radiographic film. And this processing of the radiographic film has got 4 different processes. They are the developing process, the rinsing process, the fixing process, and again a rinsing process. So once you do this, then only we get an image on our X-ray film, which we can use it for examining examining against a bright light. What happens during a development of the X-ray film? During the developing procedure, we are going to dip these films, not the cassettes, these X-ray films into the developer solution. And this happens, the processing of the X-ray radiographic films happens inside the dark room, towards the wet bench side. We will be having 4 different containers. The first container will be containing the developing solution, the second one the rinsing solution, the third one the fixing solution, and the fourth one again a rinsing solution. So in developing, in the process of developing, the actual chemical process that happens inside us, it is going to reduce the exposed silver halide crystals of the film to metallic silver, which converts the latent image into a visible one. If somebody says that I am developing the X-ray radiographic film, it means that he is reducing the exposed silver halides to metallic silver. And once it becomes, it is getting reduced, what is happening on the other side? We are converting the latent image which is present on the X-ray film towards into a form which will be visible to everyone. So that happens inside the developing solution, in the developing procedure. The reducing agent that is present inside the developer solution is the hydroquinone. This hydroquinone is responsible for converting the exposed silver halide crystals to the metallic silver, and this developing is going to provide the contrast of the image. Once you dip into the developing solution, once the developing has happened, you take out from the developer solution and then you dip into the rinsing solution. The rinsing solution, it would be the distilled water. Make sure that all the developing solution is completely removed from this from the film, so that the developing solution is not coming in contact with the fixer solution, and it is not changing the fixer solution. So, the developing is over, the rinsing is over. Once you have made sure that the rinsing has done completely, dip it into the fixer solution. What happens in fixing? We are going to remove the unexposed silver crystals so that the silver image can be retained as a permanent record. So that is the thing that we are going to do it in our fixing solution, and this is done using the sodium thiosulfate or the ammonium thiosulfate. In fixing, what is happening? In fixing, we are going to remove the unexposed silver crystals so that the silver image is retained as a permanent record. And once the fixing has happened, we are going to take it out of the fixer solution and we are going to dip it into the fourth container containing the rinsing solution. It's again the distilled water, and once you put it into that water, make sure that all the fixer solution is removed from that. Then you take this film for drying. Either it can be air dried or there are specific film dryers available. Once it is dried, it can be utilized for viewing purpose. And while dipping the film inside these solutions, let it be developer, let it be rinsing, let it be a fixer solution, make sure that you are not allowing the bubbles that are being formed inside these solutions to stick on to the film. Make sure that it is being moved 2-3 times or a few times up and down, so that the bubbles will not get attached on to the film. If the bubbles are going to get attached on to the film, that particular area will not get processed properly. And if we are unlucky enough, the actual lesion where the actual lesion where it was, that the bubble, if those bubbles are going to come and attach onto that particular area, I'm going to miss that lesion and I'm going to have a bad diagnosis. So make sure that it is not being done. But at this moment, I really doubt the locations where a conventional radiographic processing is being done. Everywhere, most of the places have changed from conventional radiographic processing to digital radiographic technique. In digital radiographic technique, the processing of the radiographic film has got no relevance. So here ends my session here. Meet you in the next session. Thank you.